With its tropical climate and home to the vast Amazon rainforest, Brazil has long been on the front lines in the fight against yellow fever.
Brazil
has accumulated a unique experience worldwide, mainly because here, for a long time, we recorded large number of yellow fever cases.
de casos de febre amarela.
And the country has played a critical role in leading best practices and lessons to control and ultimately tackle this deadly disease.
Foi no Brasil que nós identificamos.
It was in Brazil that we identified the selvatic cycle of yellow fever. We are also pioneers in the worldwide use of yellow fever vaccine.
Em escala mundial.
I'm Marcia Poole, Director of News at the World Health Organization in Geneva. In this episode, we talk to Dr. Rivaldo Venâncio da Cunha, Deputy Secretary for Health and Environmental Surveillance at the Ministry of Health in Brazil. And we hear from Dr. Pedro Vasconcelos, Professor of Pathology and Specialist in arbovirology and Tropical Medicine at Pará State University, a man who has spent decades of his life trying to combat yellow fever. He'll talk to us about the 3-year epidemic that tested the resources of Brazil and its partners and which cost hundreds of lives.
In this large epidemic that we had, with more than 2,000 cases between 2016 and 2019 in the 4 states of the Southeast region, Minas Gerais, São Paulo, Rio de Janeiro, and Espírito Santo, the number of cases was much higher than expected.
O número de casos foi muito maior do que seria esperado.
Brazil's approach to the 2016 to 2019 yellow fever outbreak was swift, and its immunization efforts were effective. But what can other countries learn from this experience? We are Eliminate Yellow Fever Epidemics, I for short. With the inside story on yellow fever's expanding global risk, this is Eye on Yellow Fever. Episode 20, Brazil, Dealing with a Yellow Fever Emergency. Dr. Pedro Vasconcelos, you are also an emeritus researcher at the Department of Arbovirology and Hemorrhagic Fevers at the Instituto Evandro Chagas in Brazil, an international fellow at the American Society of Tropical Medicine and hygiene titular of the Brazilian Academy of Science. How did your passion for yellow fever start?
Quando eu me formei em médico em 1982.
I graduated as a doctor in 1982. I joined the Instituto Evandro Chagas, an agency of the Ministry of Health, which is a national reference for arboviruses and the collaborating center of the Pan-American Health Organization and the World Health Organization for arboviruses. In 1984, there was a yellow fever epidemic in the state of Pará in Tocantins River and Amazon River regions, involving several municipalities. I was then sent to investigate the yellow fever epidemic in 1984, more precisely at the end of March, beginning of April, where I stayed for 2 weeks, mainly in Monte Alegre, but also visiting neighboring municipalities. I had already studied yellow fever, but only in books and at the university. So, for me, seeing yellow fever cases live and being able to treat, help, and diagnose was something fascinating, because yellow fever is a fascinating disease. It is the regional viral hemorrhagic fever. With these climate emergencies and climate changes, we have also focused on the aspects and influence of these temperature changes, rainfall patterns, and humidity, along with deforestation and migrations, and how this impacts the epidemiology of the disease. So, this has been the main focus of my study on yellow fever here in Brazil and in my work as a consultant for PAHO and WHO.
Brasil, onde a gente tem ido como consultor da OPA, da OMS.
In order to understand the response to the most recent yellow fever outbreak in Brazil, I wanted to hear from Dr. Pedro about the country's history with the disease. He tells me that in the 1940s, there was a significant urban outbreak of yellow fever throughout the country, reaching its most populous region, the Southeast.
Bom, existia já suspeitas.
Well, there were already suspicions that yellow fever occurred in areas where there were few Aedes aegypti mosquitoes, or none at all. But it was not possible to demonstrate which mosquito was the transmitter. The number of cases was practically much higher than it could have been.
Qual o mosquito que era transmissor?
The significant threat, however, was successfully controlled by a combination of vector control efforts and mass vaccination campaigns. Dr. Pedro, how did the strategy to tackle yellow fever take place in the 1940s?
Começou com Oswaldo Cruz, no Rio de Janeiro.
It started in Rio de Janeiro, and this strategy then spread throughout the country after its success in Rio. Basically, it was a house-to-house, street-by-street combat against the breeding sites of Aedes aegypti. DDT and other larvicidal substances were used to kill the larvae of Aedes aegypti.
Larvicidas que eram para matar as larvas do Aedes aegypti.
If you're wondering, DDT refers to a synthetic insecticide once widely used as a pesticide. It was banned in the 1970s due to its toxicity to wildlife and potential to cause cancer in humans.
E se conseguiu eliminar do país.
And it was successfully eliminated from the country for a good period. It remained out of the country from the 1960s until the early 1980s, when there was a reintroduction that could no longer be eliminated.
A reintrodução que não se conseguiu mais eliminar.
The disease has remained confined to northern Brazil, particularly within the Amazon rainforest, which covers the majority of the region. From December to May, it's largely confined to sylvatic cycles, passing from animal to animal and not spreading to urban populated areas. Dr. Rivaldo Venâncio da Cunha, from the Ministry of Health in Brazil.
Foi no Brasil que nós identificamos o ciclo silvestre da febre amarela, ali por
It was in Brazil that we identified the sylvatic cycle of yellow fever. Until the 1930s, yellow fever was understood as an urban disease. In the 1940s, around 1940-1942, we continued to have cases of yellow fever, and during this period, in Espírito Santo, we discovered this sylvatic cycle, a cycle of the disease where the virus was transmitted not by Aedes aegypti as before, but by Saberes and Hemagogus, which are sylvatic mosquitoes. Therefore, people would enter the forest, whether for work, leisure, or tourism, and get infected there. They weren't vaccinated, and that's when we discovered the sylvatic cycle. Much of the disease's pathophysiology was established in Brazil by studying, for example, liver samples from people who died of yellow fever. We are also pioneers in the worldwide use of the yellow fever vaccine. Much of the clinical management that we know included the complication of yellow fever, especially renal and hemorrhagic complications, and when it is advisable to start treatment, when not to, and what are the main signs of disease severity. This was largely scientific knowledge produced in Brazil.
Nós somos pioneiros também na utilização da vacina em escala mundial.
Even with this advanced scientific understanding of yellow fever, containment of the virus has proved difficult over the last 2 decades. And this ultimately led to the outbreak in 2016. Dr. Pedro Vasconcelos again.
O que se sabe hoje, por exemplo, que
what is known today, for example, is that a new lineage of yellow fever emerged and was responsible for this epidemic in the southeast region. We, along with other researchers from Fiocruz and the University of São Paulo, demonstrated that this lineage came from the Amazon, meaning this virus migrated from the exotic area to an episodic or epidemic area, as was the case in the southeast region.
Para uma área episótica ou epidêmica, como foi o caso da região sudeste.
But why did this happen? Well, a major factor is climate change. Rising temperatures and changing rainfall patterns have expanded the habitat of mosquitoes, also known as vectors, making it easier for yellow fever to spread beyond its traditional boundaries.
A gente sabe que os vetores, eles são influenciados.
We know that vectors are influenced by temperature. The higher the temperature, the faster the mosquitoes hatch. This has led to an increase in the numbers of mosquitoes. On the other hand, when we looked at the rainfall, we saw that the rainfall had nearly doubled the historical average between 1980 and 1989. In 2000, the rainfall was much higher than the historical average there. This favored what? The breeding sites. Thus, the increase in temperature, along with the increase in humidity and rainfall, led to an increase in the number of breeding sites. With the increase in breeding sites, it was easier for transmission to occur almost throughout the entire state.
Foi mais fácil ocorrer a transmissão, que ocorreu praticamente em quase todo o estado.
Because of this, there has been a growing risk of other arboviral diseases. Brazil has seen a significant increase in the spread of viruses like dengue, which, like yellow fever, is transmitted by the Aedes aegypti mosquito. This has created a perfect frame for the reemergence of yellow fever in urban areas. Dr. Rivaldo Venâncio da Cunha again.
O que nós observamos, então, já nesse período mais recente...
What we observed then was an explosion in the number of dengue cases in Brazil and the Americas as a whole over the last 3 years, but especially in Brazil. We used to have an average of 300,000 cases of dengue per year, but last year, 2023, we had more than 1.1 million cases of dengue, and this year, 2024, we are already above 6.2 million cases of dengue. We are experiencing high temperatures, even in the winter months. Last year, this happened, and this year even more. There is a substantial climate change with an increase in the average and environmental temperatures. The increase in average temperature favors the proliferation of mosquitoes. The time between the egg and the adult mosquito also shortens. These are interconnected factors that have contributed to this enormous increase in the number of dengue cases.
Para essa elevação gigantesca no número de casos de dengue.
The changing climate and the growing susceptibility to other diseases transmitted by mosquitoes laid the foundations for an epidemic that took 3 years to control. It was an epidemic that tested the resources of Brazil and strategy partners, the World Health Organization, Gavi, UNICEF, and the Pan American Health Organization. Was one of the first tests of the new Eliminate Yellow Fever Epidemics strategy. We'll find out what happened next. You are listening to Eye on Yellow Fever. This is episode 20. Meaning there is now a wealth of previous episodes for you to go and find in your podcast player. For example, we've recorded an episode on the Amazon, climate change, and how human-induced actions have increased the risk of yellow fever in this region. There is also an episode on public health in the climate crisis, where we explore what could happen to parts of the world previously free from pathogen-carrying mosquitoes if the Earth continues to get hotter. You'll also find the episodes on YouTube. Just search for Eye on Yellow Fever podcasts. After years of successfully keeping yellow fever away from highly populated areas of Brazil, it was becoming harder and harder to contain the disease to the north, where it was endemic. By the mid-2010s, there was a crisis brewing in the eastern state of Minas Gerais, just to the north of São Paulo and Rio de Janeiro, as Dr. Pedro Vasconcelos explains.
Minas sempre fez parte da área chamada área endêmica.
Minas Gerais has always been part of the area known as the endemic, exotic area for yellow fever, meaning yellow fever has always existed and circulated in Minas Gerais, just as it circulates here in the Amazon. And Minas was the state in the southeast region that always had yellow fever. So, for these states in the north region, in Minas, vaccination was mandatory, meaning it was recommended that 100% of the population be vaccinated. But what happened? There was a certain relaxation in the efforts to vaccinate the population.
Certo relaxamento no investimento de vacinar a população.
This relaxation came at a high cost, with 230 reported deaths in São Paulo from 2015 to 2019 and 333 in Minas Gerais from 2016 to 2018, the two most affected states in the country. As the yellow fever surge rapidly spread among the population, it became clear that an immediate and coordinated response was essential. Dr. Rivaldo Venâncio da Cunha, of Brazil's Ministry of Health.
Foram feitas inúmeras iniciativas voltadas para a participação comunitária.
Numerous initiatives have been undertaken aimed at community participation. This is a hallmark of ours, encouraging and incentivizing community involvement. In other words, organized civil society participates in the debates and the search for solutions to the major public health problems we face, whether they are problems arising from infectious diseases, transmissible diseases such as yellow fever and other arboviruses, mentioning dengue, chikungunya, and during the Zika period, this community mobilization was also very significant.
Na época da Zika, essa mobilização comunitária também foi muito marcante.
With public awareness heightened, the responsibility fell to the World Health Organization, the Pan American Health Organization, as well as the regional and national governments to establish a frontline defense against the spread of yellow fever, and that involved studying animal behavior. As yellow fever often strikes the primate population before humans, the deaths of monkeys can be used as a warning system for the prevention of the disease. You can find an episode of Eye on Yellow Fever all about this.
O macaco também era vítima.
The monkey was also a victim of this disease, and since it had greater contact with the environment, it ended up getting sick before the disease reached the population. It is our ally.
Ele é nosso aliado.
Nós tivemos casos interessantes.
We had interesting cases of monkeys that died in the squares of various cities in Minas Gerais. They got sick in the rural area, and I think by movement or instinct, ended up dying in the squares of the cities in Minas Gerais.
Morrer nas praças em cidades de Minas Gerais.
The community can play a pivotal role in being able to report dead monkeys in urban areas, which help with surveillance. It's not always straightforward, though.
Temos feito grande processo de conscientização.
We have undertaken a significant process of raising public awareness that these monkeys are sentinels that alert us when the yellow fever virus is circulating in our surroundings. Unfortunately, in some regions of the country, in Minas Gerais, São Paulo, and Rio de Janeiro, the population attacked these animals, thinking they were the ones transmitting the disease to them, which is not true.
Para elas, população, a doença, o que não é verdade.
A surveillance system was set up to identify the virus in primates.
Nós temos sistema desenvolvido aqui no Brasil.
We have a system developed here in Brazil, which is the Wildlife Health Information System. It operates through an app that is disseminated throughout the country. Any non-human primate that is found sick or dead is documented, photographed, and, if possible, because some are in the decomposition phase, but if it is still preserved, it is sent for evaluation to determine if the cause of the death was yellow fever, and, from there, trigger prevention actions.
E, a partir daí, desencadear as ações de prevenção.
For humans, the most effective measure to avoid more contamination was to promote and put into action a mass vaccination campaign.
O percentual da população brasileira.
The percentage of Brazilian population vaccinated against yellow fever is enormous, but in any case, there is caution. There are some groups, some segments, some cluster of people, especially rural workers, unvaccinated.
Trabalhadores rurais não vacinados.
And to ensure maximum coverage, the vaccination strategy mimicked the door-to-door plan that was used in the 1940s.
Era combate foco a foco, casa a casa, rua a rua.
It was a focus-to-focus, house-to-house, street-by-street combat in every city in the country. I would say it was one of the largest public health actions that the Brazilian government undertook, targeting a disease. When we had the epidemic in Minas, what happened? Cases began to appear and vaccinations started. So, people responsible for the vaccination were going to people's houses to vaccinate and calling people to go to health centers to get vaccinated.
Para vacinar e convocando o pessoal para ir nos centros de saúde para vacinar.
All these efforts were supported by an effective communication plan with daily bulletins coordinated by PAHO and WHO that kept municipalities, regions, and states aligned and informed. The communication network also included a 24/7 call-in center for healthcare professionals, offering real-time guidance on managing cases, especially due to the rapid clinical decline in cases, which required quick decision-making by healthcare professionals. Political will, alongside financing incentives, were pivotal in combating yellow fever in the years to come. An investment of 158 million Brazilian reais in 2019 and the establishment of the State Committee for Combating Arboviruses and the Regional Committees for Combating Arboviruses in 2020 led to a significant decline in yellow fever cases, with almost no new cases reported that year. What was learned? What lessons were taken from this outbreak?
Uma lição foi esta: saber que as pessoas trabalham.
One lesson was this: knowing that people work, that they will not be very available during business hours because of work, because of school, and what needs to be done is to encourage seeking vaccination on weekends or going to more isolated communities, taking the vaccine to immunize people and therefore prevent. That was one. The second is knowing that there is a transition area between the urban and wild areas, a rural area, where most cases occurred. Most of the cases did not happen inside the forest. They occurred in the rural areas. And it was in this area where a population works and lives as well that most cases occurred. So, this lesson also needs to be.
Então, essa lição também precisa ser aprendida.
Dr. Pedro, what do you think about the ICE strategy impact during the epidemic in Brazil?
A notificação foi melhor.
The notification was better. The states are more structured for notification than the Amazon and the Northeast. So the notification in this epidemic was much better. And with that, many mild cases and even asymptomatic infections, mild and moderate cases, were found that would normally go undiagnosed, unnoticed. With this, obviously, the lethality decreased considerably because more mild, moderate, and asymptomatic infections were diagnosed as yellow fever than in other epidemics. So, we were able to demonstrate this together with other institutions that investigated this yellow fever epidemic. The I strategy, I think, was very important in helping control this outbreak that occurred in Brazil, and it has certainly been important as a global strategy for the elimination of yellow fever epidemics. So, I believe that I has a role not only in education, but also in aiding in surveillance and control actions for yellow fever epidemics.
Ajudar nas ações de vigilância e controle das epidemias de febre amarela.
Dr. Rivaldo also stressed the importance of organizations like the Pan American Health Organization and the World Health Organization in helping control yellow fever, not only in Brazil, but in Latin America and the Caribbean.
Nós temos toda essa preocupação por esse vírus.
We have all this concern about this virus that still circulates in some regions. It had been in Peru, Colombia, and have been observed in many other countries. Brazil participates in this Latin American network of surveillance of the circulation of the yellow fever virus, which is largely coordinated by the Pan American Health Organization and various other governmental and not governmental organizations, especially organizations that take care of wildlife health, that take care of animal health. There are numerous organizations, both in Brazil and in other countries, that help the Ministry of Health, that help local governments to take care of animal health, and, consequently, within this care, there is prevention and preventive measures concerning yellow fever.
E as medidas preventivas em relação à febre amarela.
Diminuir, eu sei que é impossível acabar com o desmatamento, é diminuir.
I think the fundamental thing is to reduce. I know it is impossible to end deforestation, to reduce. Deforestation leads to an increase in temperature in the Amazon. alters the rainfall pattern in the Amazon. And we know that the rainfall pattern in the Amazon is fundamental for South America, not just for Brazil. So the Brazilian government and the other governments of the Pan-Amazon, that is, the countries that have a part of the Amazon, must unite to fight deforestation, and by fighting deforestation, you will certainly help in this climate issue.
Certamente vai ajudar nessa questão.
Thank you very much to Dr. Pedro Vasconcelos and Dr. Rivaldo Venâncio da Cunha for giving us their time for the exploration of dealing with yellow fever in Brazil. This episode of Eye on Yellow Fever was produced by Anna Tagliati with sound design by Adam Whaley. I'm Marcia Poole. Eye on Yellow Fever is a Bengal media production for Eliminate Yellow Fever Epidemics.